Are you over 40 and wondering if you still need immunizations? The answer is a resounding yes. In this video you will learn about why people over 40 still need immunizations, samples of immunizations that are recommended for adults, 10 things you need to do after getting vaccinated, some additional tips for adults over 40 who have been vaccinated, 19 facts most people misunderstand about the vaccines. Immunizations are an important part of staying healthy at any age, but they are especially important for adults over 40. As we age, our immune system weakens, making us more susceptible to diseases. Immunizations can help protect us from these diseases by teaching our bodies how to fight them off. Samples of immunizations that are recommended for adults are COVID-19 vaccine. This vaccine is essential for protecting yourself from the COVID-19 virus, which can cause serious illness and even death. Flu vaccine. The flu vaccine is important for protecting yourself from the influenza virus, which can cause a variety of symptoms, including fever, cough, sore throat, and body aches. Tdap vaccine. This vaccine protects against tetanus, diphtheria, and pertussis, or whooping cough. Pneumococcal vaccine. This vaccine protects against pneumococcal disease, which can cause pneumonia, meningitis, and other serious infections. Shingles vaccine. This vaccine protects against shingles, a painful rash caused by the varicella zoster virus. It is important to talk to your doctor about which immunizations you need and when you should get them. Join our community and never miss out on new content. Subscribe today. 10 things you need to do after getting vaccinated. 1. Stay at the vaccination site for at least 15 minutes after getting vaccinated. This is to make sure that you do not have any immediate allergic reactions. 2. Apply a cold compress to the injection site to reduce redness and swelling. 3. Drink plenty of fluids to stay hydrated. 4. Get plenty of rest. 5. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can be used to relieve any pain or fever. 6. If you have any concerns about side effects, talk to your doctor. 7. Schedule your booster shots, if needed. 8. Keep your vaccination card in a safe place. You may need to show it to your doctor or employer in the future. 9. Continue to practice other preventive measures, such as wearing a mask and social distancing, especially if you are around people who are not vaccinated. 10. Talk to your friends and family about the importance of getting vaccinated. Some additional tips for adults over 40 who have been vaccinated. First, be aware of the possible side effects of the vaccine. The most common side effects of vaccines for adults over 40 are mild and go away on their own within a few days. However, it is important to be aware of the possible side effects and to talk to your doctor if you have any concerns. Second, get your booster shots. Many vaccines for adults over 40 require booster shots to maintain protection over time. Be sure to talk to your doctor about which booster shots you need and when you need to get them. The last one is to continue to practice other preventive measures. Even though you have been vaccinated, it is still important to practice other preventive measures, such as wearing a mask and social distancing, especially if you are around people who are not vaccinated. 19 facts most people misunderstand about the vaccines. Myth 1. Vaccines are just for kids. Fact. Adults need vaccines too. As we age, our immune systems weaken, making us more susceptible to diseases. Myth 2. Vaccines cause autism. Fact. This myth has been repeatedly debunked by scientific studies. There is no evidence that vaccines cause autism. Myth 3. Vaccines are not safe. Fact. Vaccines are rigorously tested before they are approved for use. The most common side effects of vaccines are mild and go away on their own within a few days. Serious side effects are very rare. Myth 4. Vaccines are not effective. Fact. Vaccines are very effective at preventing serious diseases. For example, the measles vaccine is 97% effective at preventing measles. The COVID-19 vaccine is 95% effective at preventing severe illness, hospitalization, and death from COVID-19. Myth 5. Vaccines weaken your immune system. Fact. Vaccines actually strengthen your immune system by teaching it how to fight off specific diseases. Myth 6. You can get sick from a vaccine. Fact. Vaccines contain weakened or inactive forms of viruses or bacteria, so they cannot cause you to get sick. Myth 7. Vaccines contain harmful ingredients. Fact. Vaccines contain safe and effective ingredients, such as antigens, adjuvants, and preservatives. These ingredients are essential for the vaccine to be effective and safe. Myth 8. Vaccines are expensive. Fact. In many countries, most vaccines are covered by health insurance. There are maybe also government programs that can help pay for vaccines for people who are uninsured or underinsured. Myth 9. Vaccines are inconvenient. Fact. Vaccines are available at most doctors' offices, pharmacies, and clinics. You can usually get vaccinated during your regular checkups. Myth 10. Vaccines are not important for public health. Fact. Vaccines are essential for public health. They help to protect not only individuals, but also communities. By getting vaccinated, you can help to prevent the spread of diseases and protect those who cannot be vaccinated, such as babies and people with certain health conditions. Myth 11. You only need to get vaccinated once. Fact. Some vaccines require booster shots to maintain protection over time. For example, the tetanus vaccine should be given every 10 years, and the flu vaccine should be given every year. Myth 12. Vaccines only protect against the diseases they are specifically designed for. Fact. Some vaccines, such as the measles, mumps, and rubella, MMR, vaccine, can also protect against other diseases. For example, the MMR vaccine has been shown to protect against measles, mumps, rubella, and other respiratory infections. Myth 13. Natural immunity is better than vaccine-induced immunity. Fact. Natural immunity is the immunity that you develop after being exposed to a disease. Vaccine-induced immunity is the immunity that you develop after getting vaccinated. Vaccine-induced immunity is just as effective, and sometimes even more effective, than natural immunity. Myth 14. Vaccines are not necessary if you are healthy. Fact. Everyone needs vaccines, regardless of their health status. Vaccines can help to protect even the healthiest people from serious diseases. Myth 15. Pregnant women should not get vaccinated. Fact. Most vaccines are safe for pregnant women. In fact, some vaccines, such as the Tdap vaccine, are recommended for pregnant women to protect themselves and their babies from serious diseases. Myth 16. People with allergies cannot get vaccinated. Fact. Most people with allergies can get vaccinated safely. However, people with allergies to certain ingredients in vaccines should talk to their doctor before getting vaccinated. Myth 17. Vaccines interfere with the body's natural ability to fight off infection. Fact. Vaccines actually help to train the body's immune system to fight off infection more effectively. Myth 18. Vaccines can cause long-term side effects. Fact. Serious side effects from vaccines are very rare. Most side effects of vaccines are mild and go away on their own within a few days. Myth 19. Herd immunity protects everyone, even those who are not vaccinated. Fact. Herd immunity is the protection that is provided to a community when a large number of people are vaccinated against a disease. This protection helps to prevent the spread of the disease to people who cannot be vaccinated, such as babies and people with certain health conditions. Are you over 40 and living your best life? Share your inspiring story with the world and spread positivity in the comment below.